Journalist Grant Wahl died of an aortic aneurysm. Here's what you need to know about this disease. Aortic aneurysms are often called silent killers because many people don't know they've them until the aneurysm ruptures or bursts, often resulting in death. That was apparently the case for journalist Grant Wahl, 49, who collapsed in his seat Friday while covering the World Cup quarter-final match between Argentina and the Netherlands in Lusail, Qatar. Wahl's wife, physician Celine Gounder, said an autopsy confirmed that her husband died from rupture of a slow-growing, undetected ascending aortic aneurysm. The condition is one of those things that had probably been brewing for years, Gounder said. For whatever reason, it happened at that time. The Washington Post spoke with experts about aortic aneurysms, who's at risk, whether they can be detected through screening, and how they're treated. Here's what they had to say. What's an aortic aneurysm? Back to menu. An aortic aneurysm is a balloon-like bulge in the aorta that can weaken one or all layers of the aortic wall, leading to a dissection or rupture that can have serious catastrophic consequences, according to Milind Desai, medical director of the Center for Aortic Disease at the Cleveland Clinic. The aorta is the large blood vessel that carries blood from the heart through the chest and torso to the rest of the body. It's made up of 3 layers, so it can withstand a lot of pressure. However, due to genetic predisposition and certain medical conditions, some people are predisposed to dilatation, which can grow into an aortic aneurysm, Desai said. If the aneurysm ruptures or bursts, it can cause life-threatening bleeding. There are 2 types of aortic aneurysms, abdominal and thoracic, which have different risk factors and causes. The most common cause of aortic aneurysms that occur in the chest or thorax are familial or genetic, meaning the patient has a predisposition to develop such an aneurysm, Desai said. When it occurs below the diaphragm, the most common causes are atherosclerosis, the thickening or hardening of the arteries, and hypertension. What are the symptoms? Back to the menu. The vast majority of aortic aneurysms are asymptomatic, meaning they don't cause symptoms unless a dissection or rupture occurs. A dissection is a tear in the inner layer of the aorta that allows blood to leak into the wall of the aorta. That's the frustrating thing, says Amit Kilik, a cardiac surgeon at Johns Hopkins University. You can have an aneurysm without having any symptoms. In some cases, depending on the location of the aneurysm on the artery and its size, there may be some symptoms caused by the bulging vessel, according to the National Institutes of Health. These symptoms may include difficulty swallowing or breathing, bloating, hoarseness in the voice, pain in the neck, jaw, back, chest, abdomen or shoulder, a throbbing in the abdomen, shortness of breath, and swelling of the face, neck or arms. Symptoms of rupture, in which all 3 layers of the aortic wall are torn, include dizziness, a rapid heartbeat and sudden severe pain in the abdomen, chest or back. If you experience symptoms, you should see a doctor right away because time is of the essence, Kilik says. Gounder said her husband felt pressure in his chest shortly before he died, which may have been an early symptom of the ruptured aorta. No amount of resuscitation or defibrillation could have saved him, Gounder wrote on Wahl's website. His death had nothing to do with COVID. His death had nothing to do with his vaccination status. There was nothing nefarious about his death. Can I get screened for aortic aneurysms? Back to the menu. People who've a family history of aortic aneurysms, a first-degree relative with a thoracic aortic aneurysm, as well as those with certain rheumatologic diseases or connective tissue disorders, such as certain forms of Ehlers-Danlos syndrome, Lewis-Dietz syndrome or Marfan syndrome, may be predisposed and should get screened as a precaution, Desai said. 1 in 10 people with an abdominal aortic aneurysm have a family history of it, according to the NIH. Other risk factors for aneurysms include smoking or taking blood pressure-raising stimulants such as cocaine. During a screening exam, your healthcare provider may perform a physical exam or an ultrasound of your abdomen, CT or an MRI to determine if your aorta is larger than it should be. During the exam, the doctor may palpate your abdomen, listen to your heart, and check the pulse in your arms and legs. Imaging provides information about the size of an aneurysm on the aorta. As an aneurysm gets larger, it can expand quickly in shorter periods of time. Your doctor may recommend a series of scans to determine how fast the aneurysm is growing and whether you need surgery, according to the NIH. Are aneurysms always fatal? Is there a treatment? Back to menu. If aneurysms are detected and treated early, they can be repaired, Desai said. Small aneurysms can be managed with a healthy lifestyle, such as a heart-healthy diet, physical activity, and stress management, according to the NIH. All treatments aim to prevent the growth of an aneurysm, reducing the likelihood that an artery will rupture or tear. Therefore, your doctor may also focus on treating other conditions, such as high blood pressure, coronary heart disease, chronic kidney disease, or high cholesterol, to lower your risk. Once an aortic aneurysm has been diagnosed, Desai says, the most important step is to reduce stress on the aorta by lowering blood pressure and heart rate, often with medications such as beta blockers. In addition, Desai says, doctors warn these patients to avoid certain physical activities, such as intense weightlifting, which puts too much stress on the aorta, and encourage patients to control concomitant diseases such as high blood pressure, obesity, and diabetes because they go hand in hand. Not all aneurysms are fatal, Killick said. I've followed patients with an aneurysm for decades who may never need surgery.